on to our Health Watch, where we talk about all sorts of topics that are trending in the medical world, but we always talk about them with Dr. Syed Hussain from Trinity Health of New England. Joining us over Zoom this morning. Doctor, how are you today?
Great. I'm great. Thank you, Tim.
Glad to have you here. We want to start by talking about cancer. There was a study recently published in JAMA Network Open that showed cancer rates in younger people, at least diagnoses, are sharply going up. Between people aged 30 to 39, they went up about 20% from 2010 to 2019. So always the first question I'm going to ask, are people actually getting cancer in that age group more often, or are we just getting better at detecting it?
Great question, Tim. So it's a bit of both. So there's more screening, but we do see a higher incidence in this age group, under 50. As you mentioned, mostly in those folks that are in the 30s, driven primarily by an increase seen in women, and breast cancer, thyroid, and colorectal are the big top three. Colorectal in younger adults in general, we're seeing an uptick as well. Again, it could be because of surveillance, better surveillance that we now have, screening tools, but also there's other factors at play. We know some of the top risk factors for developing cancer still include smoking, alcohol, and there may be a section related to obesity and lifestyle as well.
Yeah, and we know with colon cancer, it's definitely people getting it more often. All right, moving on to the next topic. I think there's an old saying in toxicology that anything is toxic if you take enough of it. That's true, especially for water. Believe it or not, water intoxication is a thing. There's a report that a woman out of Indiana died from brain swelling after drinking about 4 big bottles of water in 30 minutes, being dehydrated. Granted, we don't know for sure that was it, but we know it's happened in the past. Just how likely is water intoxication?
So this is rare, Tim. So I just want to preface this by saying this is a rare occurrence, but yes, there is something called water intoxication, especially now as we go through these very hot summers. If you're basically getting dehydrated over a period of time, you have to be careful in terms of how much water you drink in a limited amount of time. So this particular individual that unfortunately had a bad outcome, person died. They drank liters of water within a very short period of time. And this can actually lead to a change in how the body's electrolytes function, and how there's imbalance related to that function, which can cause swelling of brain cells, leading to changes, mentation, seizures, drowsiness, nausea. Those are all signs to watch out for. But make sure that you drink, stay hydrated in the first place, and then don't drink too much water all at once.
Yes, but by far the bigger danger is not drinking enough water. I think the last time we heard of somebody dying of water intoxication, they were literally in a water drinking contest to try to just drink huge amounts of water in a short time to win a prize.
Right.
All right, lastly, there's an ongoing drug shortage right now for a big drug that's hurting patients nationwide. The shortage is, not the drug. One of which is Adderall, common medication for people with ADHD. Of course, kids going back to school. What do we know about the shortage, and are there ways to safely substitute it, maybe go with less of it, or even go without Adderall if need be?
Yeah, this is an ongoing shortage, a problem related to supply chain, related to manufacturing ability, quality issues related to the generic form of the drug, which have all led to this shortage that we see nationwide, Tim. So for viewers who are on this prescription, or you may have a child on Adderall, please speak to the clinician. See if there are alternatives to this medication. They're brand name medications, alternative drugs that may be prescribed, or could the dosage be reduced? So there are a number of things that can be considered, but the FDA acknowledged earlier this month that this is an ongoing issue.
Yeah, it's just something we're going to have to deal with for a while. Dr. Syed Hussain, thank you for taking the time while on the road to join us via Zoom to give us some of your knowledge. We do appreciate it.
Thank you very much.